Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about syphilis complications. So, each case of syphilis, its signs, symptoms, and the potential long-term complications is unique. Syphilis can damage every type of tissue and every organ within your body. So, the list of possible complications caused by syphilis runs long. That list includes major physical and mental illness. Very early in the infection, the organism invades the bloodstream and the lymphatic system. This can happen even before the first chancre. Without treatment, syphilis can lead to damage throughout your body. Syphilis also increases the risk of HIV infection and can cause problems during pregnancy. Treatment can help prevent future damage but cannot repair or reverse damage that is already occurred. Small bumps or tumors in the late stage of syphilis, bumps, which is called gammas, can develop on the skin, bones, liver, or any other organ. Gammas usually disappear after treatment with antibiotic. Neurological problems can be caused by syphilis is a number of problems with the nervous system, including headache, stroke, meningitis, hearing loss, visual problems, also blindness, dementia, loss of pain and temperature sensations, sexual dysfunction in men, bladder incontinence, cardiovascular problems. This may include bulging and swelling of the aorta and of other blood vessels. Syphilis may also damage heart valves. As regards adults with sexual transmitted syphilis or other genital ulcers have an estimated 2 to 5-fold increased risk of contracting HIV. A syphilis sore can bleed easily, providing an easy way for HIV to enter bloodstream during sexual activity. Also, there is complication as regards pregnancy and childbirth. If you are pregnant, you may pass syphilis to your unborn baby. Congenital syphilis greatly increases the risk of miscarriage, stillbirth, or your newborn death within few days after birth. As regards the prevention, there is no vaccine for syphilis. To help prevent the spread of syphilis, follow these suggestions. Abstain or be monogamous. The only certain way to avoid syphilis is to avoid having sex. The next best option is to have mutually monogamous sex, in which both partners have sex only with each other and neither partner is infected. Use latex condom. Condoms can reduce your risk of contracting syphilis, but only if the condom covers the syphilis source. Avoid recreational drugs. Misuse of alcohol or other drugs can inhibit your judgment and lead to unsafe sexual practice. Partner notification and preventive treatment. If tests show that you have syphilis, your sex partners, including current partners and any other partners you have had over the last 3 months to 1 year, need to be informed so that they can get tested. If they are infected, they can then be treated. Officially confidential partner notification can help limit the spread of syphilis. The practice also steers those at risk toward counseling and the right treatment. And since you can contract syphilis more than once, partner notification reduces your risk of getting reinfected. Screening for pregnant women, people can be infected with syphilis and do not know it. In light of the often deadly effect of syphilis can have on unborn children, health officials recommend that all pregnant women be screened for the disease. So, as regard this bacteria, a spiral-shaped microorganism can easily pervade every corner of your body. It invades the heart, bones, and the digestive tract. It can impact your hearing, your vision, all your major organs. It can invade the liver, the skin. It goes everywhere. In the pregnant woman, Treponema pallidum crosses the placenta to infect fetus. When the bacterium infects the central nervous system, the brain and the spinal cord, it is called neurosyphilis. So, it can cause insanity, blindness, paralysis, and death. On the other hand, with early diagnosis and treatment, syphilis can usually be cured with one injection of penicillin. But the growing problem of antibiotic resistance has come into play with regard to syphilis treatment, and the Global Health Organization have revised their treatment recommendation to address it. So WHO strongly recommends single shot of penicillin G, benzazine penicillin, instead of oral antibiotics. The injection works better and costs less than pills. Untreated syphilis may lead to complication, and the individual who have syphilis remain infected for life unless they take antibiotics. Early treatment with antibiotics can prevent serious harm, but if your treatment begins after organs or tissues have been damaged, antibiotics cannot reverse that damage. Syphilis can spread throughout your body, gives the power to cause life-changing complications, especially but not only in its latest stages. Syphilis involves 4 different stages, but sometimes stages overlap or even occur at the same time. Not every stage will create noticeable symptoms either, and the symptoms do not appear in the same order for everyone. So, we have to treat syphilis in early stages before making major complications. Thank you very much.